A big medical change is happening now. This change can help fight serious diseases. Cancer is one of them. This medical change is called angiogenesis. Angiogenesis means making new blood vessels. Why are blood vessels important? Because our body is full of them. An adult has about 60,000 miles of blood vessels. That distance can go around the Earth 2 times. The smallest blood vessels are called capillaries. We have about 19 billion capillaries. They carry oxygen and food to cells. They keep us alive. But sometimes they also help disease. Blood vessels are very smart. They change shape based on where they are. In the liver, they clean the blood. In the lungs, they help us breathe. In muscles, they twist so muscles can move. In nerves, they run like electric wires. Most blood vessels form before we are born. As adults, new blood vessels usually do not grow. They grow only in special cases. For example, in women during the monthly cycle. During pregnancy, they form the placenta. After an injury, they grow to heal a wound. The body controls blood vessel growth very carefully. It uses a balance system. Some signals tell vessels to grow. Some signals tell them to stop. The growth signals are called angiogenic factors. They act like fertilizer. They help new vessels grow. When the vessels are no longer needed, the body removes the extra ones. This keeps the balance normal. Sometimes this balance fails. Then angiogenesis becomes abnormal. This causes disease. Too few blood vessels cause problems. Wounds do not heal. Heart attacks happen. Strokes happen. Nerves get damaged. Too many blood vessels also cause disease. Cancer grows. Blindness happens. Arthritis increases. Obesity grows. Alzheimer's disease appears. More than 70 major diseases share this problem. Over 1 billion people are affected. The common problem is abnormal angiogenesis. Now let us talk about cancer. Cancer always depends on angiogenesis. Every cancer type needs blood vessels. A tumor looks like a dark mass. Inside it, many blood vessels grow. They feed cancer with oxygen and food. But cancer does not start this way. It starts very small, very tiny, so small it cannot be seen. At this stage, cancer has no blood supply, so it cannot grow bigger. It stays harmless. Many people have these tiny cancers. They never know about them. Studies show this clearly. 40% of women aged 40-50 have tiny breast cancers. 50% of men aged 50-60 have tiny prostate cancers. Almost everyone over 70 has tiny thyroid cancers. Most of these never become dangerous because they have no blood vessels. This is called cancer without disease. The body normally blocks blood vessels from feeding cancer. This is a strong natural defense. But cancer cells can change. They release many growth signals. This attracts blood vessels. Once blood vessels enter the cancer, the tumor grows fast. It spreads. It becomes deadly. So angiogenesis is the turning point. Harmless cancer becomes dangerous cancer. This leads to a new cancer treatment. It is called anti-angiogenic therapy. This treatment cuts off the blood supply. It does not attack cancer cells directly. It attacks the blood vessels feeding them. Tumor blood vessels are weak. They are badly made, so they are easy to target. When patients get this treatment, tumors shrink or stop growing. This works in different cancers: brain cancer, breast cancer, and more. This method was also tested in animals. A dog named Milo had an aggressive cancer. Doctors gave him only 3 months. He received anti-angiogenic treatment. His life was extended 6 times longer. His life quality stayed good. Over 600 dogs were treated this way. About 60% showed improvement. A dolphin with mouth cancer was treated. The cancer disappeared. A horse named Guinness had deadly cancer. After treatment, the cancer vanished. He lived many more years. Anti-angiogenic drugs are now used in humans. Since 2004, survival improved greatly in some cancers. Kidney cancer, colon cancer, blood cancers. But results are not perfect. Why? Because cancer is treated too late, often after it spreads. So the question is different now. Can we prevent angiogenesis in cancer? Diet gives us a clue. 35% of cancers are linked to diet. Instead of removing foods, we asked a new question. What foods can block angiogenesis? The answer, many natural foods. Nature gives us anti-angiogenic foods. Red grapes, strawberries, soybeans, green tea, parsley, garlic, berries, tomatoes. These foods reduce blood vessel growth. Some teas work better than others. Mixing foods works even better. This is called food synergy. Some foods are as strong as drugs, sometimes stronger. A famous study followed 79,000 men. Men who ate cooked tomatoes often had 50% less prostate cancer. Even when cancer appeared, it had fewer blood vessels. This shows food really works. Eating well helps prevent disease. It is affordable. It is safe. It is available to everyone. This idea also helps obesity. Fat needs blood vessels to grow. Block the vessels, fat shrinks. In mice, blocking angiogenesis caused weight loss. Stopping caused weight gain. Restarting caused weight loss again. But weight never went below normal. The body keeps balance. This shows angiogenesis controls healthy limits. In short, many diseases share one cause. That cause is abnormal angiogenesis. If we control it, we can fight cancer. We can fight obesity. We can protect health. What we eat matters. Food can be medicine. 3 times a day.